Coding Guidelines, Section 1, Chapter 9, Subsection E, Number 1. Type 1, ST elevation myocardial infarction, or a STEMI, and a non-ST elevation myocardial infarction, or an NSTEMI for short. The scenario is an acute inferior wall NSTEMI that evolved into a STEMI. You're going to want to remember this acute inferior wall and that it evolved. So let's go to the 3M encoder. So we start with infarct, infarction, myocardium, ST elevation, inferior wall. There's that non, so inferior. I-21.19. That is exactly correct. I always still like to check. Make sure that there's not a use additional. Use additional is all tobacco use. What it includes is an infarct of the heart, which is what this is. So that is the code. Now let's go back to the rationale for this. So we went for infarct, infarction, myocardium, and we got the I-21.19. The rationale is the ICD-10-CM codes for type 1 acute myocardial infarction, or the AMI, identify the site such as the anterior lateral wall or the true posterior wall. This one is the inferior wall that we went for. Subcategories I-21.0 to I-21.2 and code I-21.3 are used for type 1 ST elevation myocardial infarction, or the STEMI. The I-21.4 is the non-ST elevation myocardial infarction, or the NSTEMI, and it is used for type 1 non-ST elevation myocardial infarction and non-transmural MIs, or myocardial infarction. If type 1 NSTEMI evolves to a STEMI, assign the STEMI code. If a type 1 STEMI converts to an NSTEMI during a thrombolytic therapy, it is still coded as a STEMI. That is the highest level of what happened to it. For encounters occurring while the myocardial infarction is equal to or less than 4 weeks old, this is kind of important that you know this 4-week rule with the infarctions. So equal to or less than 4 weeks old, including transfers to another acute setting or post-acute setting, and the myocardial infarction meets the definition for other diagnosis, please see section 3 of the coding guidelines about reporting additional diagnosis. This will help get this in help you remember this. Codes from category 21 may continue to be reported. For encounters after the 4-week time frame and patients is still receiving care related to myocardial infarction, the appropriate aftercare code should be assigned. So remember that aftercare word. So the aftercare code should be assigned rather than a code from category I-21. For old or healed myocardial infarctions not requiring any further care, you code the I-25.2. Old myocardial infarction may be assigned. You might need to go over this coding guideline a few times before, because there's a lot to this one. But again, this is coding guideline, section 1, chapter 9, subsection E, number 1.